Hi friends, welcome to the Emergency Medicine channel. Myself Dr. Ashik Envy, doing post-graduation in Emergency Medicine. Today we are going to discuss about physiological and anatomical changes in pregnancy. We are only discussing those changes which are important in view of emergency medicine. Okay, so let us start with the physiological changes in pregnancy. We can discuss system wise. So first one is hematological changes. Okay, hematological changes. First one is in a non-pregnant female, the blood flow to uterus is like 50 ml per minute. But in a pregnant female, the blood flow to uterus is 500 to 700 ml per minute. That is, uterine blood flow increases in pregnancy. Okay. The second change, the plasma volume increased by 40 to 60 percentage. But RBC also increases, but the increase in RBC is 20 to 30 percentage. So the RBC increase is less in comparison with the change in plasma. This is called physiological hemodilution. Okay. So due to the physiological hemodilution, viscosity of the blood decreases. Okay. And the other component in the blood is platelet. Platelet also decrease in platelet count. But there is an increase in WBC count and the normal value shifted to 15,000. Okay. Again, as we know, pregnancy is an hypercoagulation state. Okay. So there is increase in all coagulation factors increases, except there is an exception, except factor 11 and factor 13. Okay. And also fibrinogen is a coagulation factor. As fibrinogen increases, ESR also increases. Okay, that is about hemodynamic changes. Now moving on to cardiovascular system, CVS. So in CVS, cardiac output increases, and the increase in cardiac output starts by 6th week of intrauterine life. Okay, and it is maximum cardiac output is at 28 to 32 weeks. Okay, so this is about cardiac output changes in pregnancy. Next is heart rate also increases by 15 beats per minute. Okay. Regarding BP, there is a mid-trimester fall in diastolic BP. Mid-trimester fall in diastolic BP. Okay. But the MAP, mean arterial pressure, remains unchanged. There will be no change in MAP. And apex beat will shift to 2.5 centimeter left of mid-clavicular line. Okay. Again, the change in ECG. In ECG, there is a left axis deviation which is normal. It is due to the change in apex, position of apex beat the change will change to left side, so it will produce an left axis deviation in ECG. Again, in hard sounds there will be loud S1, but the S2 will be normal S2, and occasionally S3 may be audible S3. Okay, and also there will be less than grade 2, that is grade 1 ejection systolic murmur. It is also a normal finding in pregnancy. Okay, and the central venous pressure and pulmonary capillary wedge pressure will be unchanged. Again, in pregnancy, in supine position, there will be compression of IVC leads to decrease in cardiac output. Okay, so it is preferred to position the patient in left lateral side, especially in T3. Okay, in order to prevent the IVC compression. Also, the IVC compression can cause severe hemodynamic compromise. It will decrease the venous return. So during resuscitation in a pregnant female, put the IV axis above the diaphragm. Okay, that's about cardiovascular system. Moving on to renal system. In renal system, there will be increase in renal blood flow by 50%. GFR also increases. Serum creatinine and blood urea will decrease. Okay. Glycosuria will be there. Glycosuria present. Okay. Serum sodium, potassium chloride will decrease due to hemodilution. Causes decrease in sodium, potassium and chloride. Renal size increases. There will be increase in renal size. Okay. Now protein changes in pregnancy. Albumin decrease, but total protein increases. Fibrinogen increases. Globulin may be normal or increases. Okay, now the respiratory system changes. In respiratory system, certain respiratory system parameters decreases, some are increasing and some remains unchanged. So let us see which all respiratory parameters decreases. There will be a decrease in residual volume. Hence there will be a decrease in functional residual capacity. Hence total lung capacity also decreases, and expiratory reserve volume also decreases. And the factors which are increased during pregnancy include tidal volume, inspiratory capacity and minute oxygen uptake. And the factors remains unchanged are vital capacity, inspiratory reserve volume and respiratory rate. Again, during pregnancy, the diaphragm will shift upwards. So the lung get compressed. So lung is compressed by 4 centimeter. This is causing a decrease in residual volume, functional residual capacity, and total lung capacity. Okay, this is all about the physiological changes in pregnancy. Moving on to the anatomical changes. Anatomical changes in pregnancy. So the anatomical changes are mainly affecting the airway management in pregnancy. So let us look what are the anatomical changes making airway management is difficult. Okay, so the first point is fluid retention. Fluid retention leads to edema. So which can cause edema in upper airway structures. Okay, also due to the weight gain there will be adipose tissue deposition. So the adipose tissue deposition in upper airway makes landmark distortion. So there will be a difficulty in back mask ventilation. Okay, laryngoscopy, glottic visualization, and also for endotracheal intubation. All these procedures will become difficult. Okay, and also during pregnancy the incidence of Mallampatti class 3 increases. Okay, that is you cannot visualize the deeper structures like tonsillar pillars, etc. Okay, and the capillaries will be fragile. Okay, the fragile capillaries can cause airway bleeding, leads to airway bleeding. Okay, and there will be prominent pharyngeal and palatal folds. Okay, pharyngeal and palatal fold. Okay, it is also make the airway difficult, and also decrease in lower esophageal pressure, increased intra-abdominal pressure. Okay, and decreased gastric emptying time are these factors together contributes to increase the risk of aspiration. Okay, so that's all about the important anatomical and physiological changes in pregnancy in an emergency point of view. Okay, so kindly consider subscription of my channel if you are interested in emergency medicine videos. Thank you.